Hey guys, welcome back to my channel. My name is Ashley. Thank you for tuning in. If you're new here, you're highly welcome. So guys, I know the title of my video is a little bit scary. It's a little bit I don't know how to say it, but guys, please don't get me wrong, don't misquote me. I'm just here to state the obvious, okay? I'm not here to scare anyone. I know there are a lot of moms who are pregnant. I know they are future moms. Please, I'm not here to scare anyone, okay? I'm not here to say anything from the ordinary, okay? I'm just here to state the obvious. That's all. So guys, today I want us to talk about some of the things women go through during pregnancy. Yeah, I know there are people who already have a lot to say about this. So guys, the first thing I want us to talk about is vomiting and loss of appetite during pregnancy. Guys, I know there are some women who actually are fine throughout their pregnancy. There are some women who don't get sick, who can actually go to work, who can cook, clean, do everything normally during pregnancy, and there are others who cannot even stand up during pregnancy, guys. And I'm one of those people. I can't do anything during the first trimester of my pregnancy. For my first son, I used to throw up a little bit, like maybe 4 to 5 times a day, but with the triplets, I used to go like 7 to 8 times a day, at least. I actually don't eat anything. I smell everything, and I just keep throwing up. It just keeps coming, you know. And when you throw up quite a lot, it might lead to dehydration. It's not actually good for your health or the health of the baby during pregnancy. So when you get seriously dehydrated, sometimes it can be treated, and sometimes you can get better after the first trimester of your pregnancy. But I think for the triplets, it was some kind of sickness, and I had no idea, because back in Cameroon they always tell us, oh, it's okay, after your first trimester everything is going to be fine. I did the first month, second month, third month, fourth month with the triplets, and I was throwing up back to back. I could not eat anything. I think I lose about 15 to 20 kg during that pregnancy, because I could not eat anything. I smelled everything, like everything was irritating. You walk around, you get the smell of people, you smell everything. Nothing feels nice, okay? When I'm pregnant, during that period when I'm vomiting, it's like my world has come to a standstill during that period. That's how I feel, okay? And I know a lot of moms who are going through it as we speak. So guys, vomiting and loss of appetite, dehydration is something we cannot joke about during pregnancy. Another thing I want us to talk about is excess cravings. My people, there are some people that will their cravings during pregnancy is something you cannot even explain. They feel like to eat everything, from all the things that are not normal. So sometimes you see some women, when they are pregnant, they eat mango and salt. Some eat maybe sugar and some other things. Some drink water with sugar. Some drink water with salt. When you're pregnant, the cravings are just crazy. And sometimes the craving, it doesn't just come during the normal period when you're awake. Sometimes it comes in the middle of the night. In the middle of the night, you start thinking about your grandmother's soup that she made probably 10 years ago. You start getting the aroma from you don't know where. You start feeling like that soup is what you want to eat at that particular moment. Trust me, if you have the means, you wake up to go and search. You start feeling like, oh, in Cameroon, you feel like, oh, I want to eat fish. Not some particular fish, but a fish that is roasted by a particular person. And if it's not that person, you're not going to eat. And sometimes people even go as far as getting you what you want, but you even look at it like, this is not exactly what I want. This is not the aroma of the fish I was talking about. Like, you are specific. Like the cravings is something you cannot even control. Sometimes you cannot even control. That's why some people, like, it can make people around you look at you as if you're running mad or something, you know. But it's normal. With some people, they are fine during their pregnancy, they don't have any kind of cravings. But there are some people, trust me, if you're beside them, you maybe want to leave just because of the way they behave when it comes to their. Some people even eat calabar. I don't know how calabar is called, or it's alkaline or what. I don't know how calabar is called in English. That is what some people eat from the beginning to the end of their pregnancy. So guys, cravings is something I really do not like. I really do not appreciate. I really do not ever want to feel that again during pregnancy. So guys, another thing you might also want to talk about during pregnancy, I think this comes like during the second and the third trimester of your pregnancy, is hip pain. Guys, hip pain, like the side of your, I don't know, of your hip, then going down to your legs. Some women actually cannot walk during pregnancy because of hip pain. When that pain, and it can last there from your second trimester till you give birth, until even after you give birth. Some people actually still feel that hip pain in a way that they cannot even walk by themselves. Sometimes people even use crutches because of hip pain. Sometimes some people cannot even take up to 10 steps. Only hip pain. And hip pain is caused by, when you're pregnant, you kind of gain weight, and then the hormones, the changes in the hormones and everything, it causes that hip pain. And guys, trust me, it's not something to joke about. Hip pain is very, very serious, and I don't even know how they kind of cure it, because sometimes people go to the hospital. I had a friend who was pregnant when we were younger, and she used to walk some type of way during her pregnancy. And there was one time I saw her. I looked at her and I asked her, my friend, why are you walking the way you're walking? Like, are you not just pregnant? Why are you walking like? She's like, Ash, I'm having a hip pain. It's so severe. It's so painful. I'm like, and you're walking like a newborn baby who just pooped in the pants. She's like, yeah, it's so painful. It's so painful. And I'm like, no. If it's this type of way I'm going to walk when I'm pregnant, I really do not want to be pregnant. I was so mean to her. I had no understanding. I had no clue about hip pain. But trust me guys, with the triplets, when I was about 6 months, my husband used to bring the car right in front of the door to carry me, because I could not walk. I could not walk. If you ask me, come and take something, I would just stand somewhere and just be looking at you, because I could not walk. So guys, hip pain is something that you cannot even joke about during pregnancy. Guys, another thing I know this one is funny, but it's true. Pregnancy can make you turn into a researcher. My goodness. I know many people are in this WhatsApp group. And some people, when they are pregnant and somebody comes beside you, the person starts saying, when I was pregnant, my baby had this type of disease. And then, trust me, you pick your phone and Google. You start checking what's the name of the disease, how did this happen, why it happened. Guys, if somebody comes beside you and start telling, during my pregnancy, I developed this, that, and that, you pick your phone, Chrome, Wikipedia, everything. You will try to search the name of that sickness. If somebody even opened their mouth and say, oh, when you're pregnant, there are some type of foods and there are types of fruits that you cannot eat, you go straight to your phone to Google search the type of foods you will not eat. And guys, if you are pregnant, your baby stays for like 2 hours, 3 hours, no kicking. When you touch one, are you there? Nothing. Are you there? Nothing. Guys, you pick your phone and search. How many hours does it take for a baby to be silent? Guys, pregnancy can make you to become a researcher, and trust me, it only ends after you must have given birth. The pressure only ends. Even after giving birth, you still continue to search things on your phone, because you just want to be sure. You just want to have your head filled with that information that you actually need. So guys, another thing I know that is funny, I don't know if it happens to all women or it's just me, is dreams during pregnancy. Guys, I personally, I will not even take it for a joke. When I'm pregnant, I become Joseph the dreamer. I would dream. Immediately I sleep, 3 minutes, I'm gone. I'm already in Jerusalem, helping Jesus. Like, I'm there fighting people that were trying to kill Jesus during that crucifixion. The next minute, I'm Spider-Man. The next minute, I'm Rambo. I'm just going all over the place. And trust me, if you tell the person that is next to you that those are the type of dreams you're having, the person will just laugh. Because there's no, and you yourself, when you wake up, you'll be like, what was I even doing? You dream, you even dream that you were with President Barack Obama. You just have constant crazy dreams, fights, and going to places, flying here and there. Guys, dreams are what I think is part of that pregnancy journey. I don't know, some people, I think there are a lot of people who would tell me that, oh, it's true, I was actually like dreaming like this during pregnancy. Another thing I want us to talk about is heat. During pregnancy, that heat, we usually don't understand. We usually don't know. Like, I personally, I really don't know where that heat is coming from. You know, when I was pregnant, often at times I was with my pants and my bra. If I wanted to be too nice, I was with my pants and my bra. And then, like, the heat you feel, I don't know if it's coming from outside or from inside. Sometimes, like, you ask the person that is next to you, like, are you feeling heat? The person will be like, no, I'm not feeling heat. It's actually very cold. You'll be like, okay, maybe this one is just me alone. That heat, you're feeling it alone. Nobody is understanding. It's only within you. And the worst part is when you go out and then some of us who usually do this week and everything, you go out after putting on the clothes and everything, and then trust me, you start removing the wig and the clothes from the door before you even get home. Sometimes you even remove your slippers from the door before you even get home, because you just feel so uncomfortable. Putting things on is so uncomfortable. Most at times, I'm very sure more than 70% of women during pregnancy are always bare body. I personally am on that WhatsApp group. I know my friends who have been pregnant. I've never been to their houses and they have clothes on all the time, bare body, all the time. So guys, this one is kind of serious. So another thing you might develop during pregnancy or postpartum is the carpal tunnel. Carpal tunnel is the pain that affects your nerves, I think from here to like here, and that pain is unbearable. It makes your hand sometimes, your hand sometimes it feels numb. You can't use your hands. Your hands are actually useless. The kind of pain carpal tunnel can give on your palm, they can give your baby after giving birth. You will not be able to carry because of pain. You cannot even describe the pain, because sometimes you even go. I had it with my first son, and the doctor didn't even know what it was. I'm even trying to explain to him, like, I have this pain that is here, sometimes here. I'm trying to explain to the doctor. They did x-ray, everything. They didn't even know what I was trying to explain. That's carpal tunnel. And then even with my triplets, I developed carpal tunnel with both hands, and I did physiotherapy, but I don't know, maybe it's because of time, because even after the physiotherapy it didn't go anywhere. Maybe due to time. Now I feel much better. And my kid says that she just had twins and she has also developed carpal tunnel on both hands. It's very painful and you can barely do anything when that pain is there. Your hand, you cannot wash, you cannot clean, your hand is almost useless. And sometimes carpal tunnel is being corrected with surgery, or sometimes it can heal by itself. Like I didn't go for surgery to correct mine healed naturally. So guys, it's your choice. You can always choose to go for a surgery or allow it to heal naturally, especially when your babies grow up and then you stop using the hands too often. Another thing we are not forgetting is pre-eclampsia or eclampsia during pregnancy. Preeclampsia is like the increase in blood pressure during pregnancy, and eclampsia is the increase of blood pressure during pregnancy, which might cause sometimes seizure, and sometimes some women can actually go into coma, and sometimes women actually die during eclampsia. So guys, it's something that many people usually like take it very serious, especially if you're in an area where the health system is good. Most of the time when the babies get to like, baby gets like 37 weeks, 38 weeks, most of the times they take it out. 36 weeks, it just depends on how your preeclampsia is. They take it out because they just want once the baby's safety. People just schedule their C-sections and take the baby out because, you know, if you keep the baby right to the end, you are risking the life of the baby and even your own life, because you might get eclampsia while trying to give birth during labor, and many other things can go wrong, you know, many other things can go wrong. So preeclampsia and eclampsia is one of those things you might develop during pregnancy, and trust me, it is serious. It is serious because people actually die. So another thing I want us to talk about is increase in or blood sugar during pregnancy, and it's called gestational diabetes. And during gestational diabetes, when your blood sugar keeps on increasing, it needs to be controlled. So most of the times, like if you're in an area where the healthcare is good, most of the times people use medications throughout their pregnancy, and when they get to like 37 weeks, they always schedule the C-section because you might risk it, because in as much as the baby continue consuming the sugar that is in you, the baby has the chance to like increase bigger, and once the baby increase more than the baby should, then there'll definitely be no space in the womb anymore for the baby, which might actually lead to death before the baby is even born. So my friend, I'm so sorry for her. She just lost her baby because of her blood sugar, and the baby was left right to the end, probably 41 weeks. So before they could take the baby out, the baby passed away. So it's a very sad situation. It's a situation that people need to take seriously. That's why like if you're living abroad, you have a better healthcare system. People always try to do the C-section way before the baby gets to like 37 weeks. And for those who are in areas where the healthcare is not good, the doctors they're just trying their best because the healthcare systems are failing. Most of the times people with that situations end up losing their babies. So guys, let's not forget this measure one, labor. Guys, we'll talk about pre-labor, like the Braxton Hicks contraction, and then we'll talk about labor itself. The Braxton Hicks contraction, it comes sometimes during the third trimester, sometimes it starts from the second trimester. Guys, sometimes it can get a little bit serious and a little bit confusing for some people, where you might actually go to the hospital a couple of times just to ask like, what's going on? Am I in labor? It's not yet time. Just to be sure, especially for newborn, people go to the hospital many times just to be sure. But Braxton Hicks contraction tries to prepare your body for the labor you're going to have in the future. So that's why sometimes you feel like, oh, if it's labor, and it's a little bit confusing. But guys, let's keep that aside. Labor itself, can we talk about labor itself? I personally, I have not experienced, because when I talk about how many minutes, how many hours I spent in labor, and people are like, that's not labor, you have not even experienced. What I saw with my eyes when I was pregnant, my labor actually wasn't progressing. So I would labor for like an hour, and a little blood would come out, and then I would just go to sleep, and then I'll sleep for hours, then like for 4 hours, then you start again, and then you stop. So it wasn't progressing, and then the birth canal was so close, there was no way for the baby to come through. So, but you know how Africa is. The doctor was still thinking, oh, maybe we don't need to give you a C-section. Maybe we can give you forced labor. You know how Africa is. We can give you forced labor and everything. I'm like, okay, let's see. Guys, the doctor took me to the ward where the other women were having forced labor. I saw something with my eyes. Christ, The pain, I saw people, the way women were crying, everybody is crying in their own direction, shouting and screaming. And then I just told the doctor, you see this one, I'm not doing it. Just go and do me the C-section. I cannot go through the pain of going through forced labor, and then they'll come and tell you later that the birth canal is still closed. Now we need to go through C-section. That's double the thing. The pain that I felt only for 1 hour, I felt like my life was going to end. The little pain I was feeling when the pregnancy, the labor was not progressing, I felt like my life was going to end. Then you want to tell me let's go to forced labor, and then if it doesn't, things don't go well, then we'll go for a C-section. Who will be risk? I'll not risk my life and then risk the life of the baby. Why will I be bearing two pain at the same time? No, I just told him no, I'm not ready for any other thing. Let's just go for the C-section. That's how that topic ended. But guys, you know, with some women actually labor for 48 hours, some labor for 24 hours, some 18 hours, some 15, and some 10. And labor is no joke. The way it will pin you from your back, I don't even know how to describe it, because when I talk about it, people are like, so you think that's labor? Guys, labor is no joke. Labor is not for the weak. And to be honest, I'm not, as I earlier said, I'm not here to scare anyone, but trust me, when it comes to labor, guys, be prepared. My sisters, be prepared. Labor is not a joke. So guys, we have finally come to the end of this video. If you have any contributions to make, you can always write it down at the comment section. I know there's a lot that has been left out due to time. I really don't want to make the video boring, so please don't forget to leave your comments. And thank you all for watching. See you guys on my next video. Bye.